Hello, this is Dr. Naim, your favorite OBGYN. Today I'm going to talk again about something I've been spoken about before, and that's heavy menstrual cycle or irregular vaginal bleeding, or DUB, which is very common. I see it on a daily basis. Patients come complaining that they have heavy periods, and this causes them problem. They cannot function during those times. Somebody comes with that situation, especially in younger women. We do a basic workup, ultrasound, do some hormone tests. Sometimes it could be an anatomical issue that causes this. If you see this is the uterus, could be something like a fibroid inside the uterus cause this. Could be a polyp that can cause this. An older woman could be cancer or precancerous cells that requires a biopsy. But if these are normal and there is no such issues, some people might have some bleeding problem that we check for those. If there is nothing major as far as polyps or any abnormal cells, there are different ways of managing this. A lot of times we start with something like a birth control pill on a regular basis and take it to make the period less painful and more regular. Sometimes I recommend injection like Depo-Provera, which is also birth control every 3 months, make the period less and less painful. These have side effects, the hormonal can cause weight gain, other problems, so not everybody likes it. We also have something called Nexplanon, which is again a birth control, goes in the arm, goes for 3 years. It can also decrease the period. Something is less hormonal is a kind of hormonal IUD. Even though it's hormonal, because it's only inside the uterus and very small amount of hormone gets secreted, it can help to decrease the period, the amount, and also makes it usually less period. So an IUD wouldn't regulate you, but a lot of my patients on a hormonal IUD don't have a period for months or for years. It's okay with that, and that helps them in that regard. The other option beside this could be a procedure we do called hysteroscopy. Put a camera through the vagina, through the uterus, and we can look for any polyp, or sometimes we can even burn a line of the uterus like an ablation that makes your period less. That's very helpful for a lot of patients. There is also newer medications that can cause the patient to have less bleeding. There's a pills you have to take every day. There are 2 of them on the market that patients can take every day, and it makes the period less. But again, you have to take the pills every day. So these are the main options available.